Set up for a two-piece support and a BSSO.
Yes.
Okay. I was seeing an upper dental midline pretty close to being on with the facial midline.
Yes, very close. Maybe like a half a millimeter tad to the right side, but maybe less. Yeah.
Okay. Yeah, that's exactly what I'm seeing. I'm seeing maybe a little bit of cant down about a millimeter or a millimeter and a half on the left side. The canine, does that sound right?
Yeah, the right canine is higher by 2-3 millimeters. It's higher on the right side by 3 millimeters. Yeah. We can look at the facial markers. I put all the facial markers on him in the natural head position, so I think we should go by mostly by his facial markers too. At the skin level.
I'll try to. Yeah, I should be able to.
Just to verify his natural head position.
There we go. Yeah. Okay, so going by those facial markers, I'm not seeing quite as much cant. That right canine is superior by about 1.5. You said you were seeing 3 millimeters?
Yeah.
Okay. I can definitely adjust it. Looks like we might be deviating a little bit from the facial markers.
Yeah.
So 3 millimeters of cant would be about this much. Does that look right too? Does that look alright?
Yeah, well, let's look at the profile view, because I put the right skin markers too in him. Yeah, that should be a little bit maybe more vertical. That I think he's like leaning down a little bit. Yeah, this line from the right there. Yeah.
Okay.
Yeah, maybe just a smidge down. Yeah, just a smidge down. Just to line them up. No, the other way.
Other way, okay.
Yeah, the other way, just a little bit. So maybe a little bit more, just a smidge more. Yeah, probably. Yeah, something like that. Yeah, something like that. Yeah, I think that's more or less.
Yeah. Okay. Well, I'll go ahead and put everything into final occlusion here. Pretty big palatal expansion, it looks like.
Yes.
I will correct that slight midline deviation, about a half millimeter, moving to the patient's left. Correct that, and then I'll level out that cant as well. Bring that to the left side up.
Yes.
Okay, there we go. So the canine's level. Chin is pretty much on with the facial midline.
Yes.
All right. What did you want to see as far as AP or vertical change?
Well, he needs a lot of advancement, so it's 10 millimeters at the incisal edge.
Okay. Any vertical change at the incisal edge or differential impaction?
2-3 millimeters down. Maybe about 2 millimeters for now. I may increase it clinically just.
Okay. Just bringing everything down bodily, or did you want to keep the molars where they were?
It depends. I don't want to increase his occlusal plane. I probably should stay the same. So yeah, let's do bodily for now. See where.
Okay, you got it. So with that cant correction, your left first molar is staying pretty much where it was vertically. We're bringing that right first molar down about 3.5, and the incisor is coming down about 2, and forward a centimeter.
Yeah.
And the lower incisors are advancing almost 18 millimeters, and Pugonian coming forward about 10.5.
Mm-hmm.
Check the yaw. mandible looks pretty good. From the rotation of the segments, you might be seeing a little bit more of a step on the right side to look for it.
Yes.
But everything else looks like it's pretty symmetric. Even amounts of interference on the mandible.
Mm-hmm.
Go ahead and I'll kick those segments out here. Try to line those inferior borders up. You are from that big advancement. There's going to be quite a bit of interference in that inferior portion of the distal mandible on both sides. You'll
Yeah, I see
be
that.
seeing a good amount of reduction or in fracture.
Mm-hmm.
Does that all look good to you, or do you want to make any adjustments or take a closer look at anything?
I was thinking of rotating his occlusal plane a little bit too, because
Okay.
we need the chin out, and I know he's at 8, but we're probably gonna take it to -5 to get him more chin, because that's his main
Cool.
issue. Is the chin.
Yeah, absolutely. Do that, no problem. Now you're getting close to 12.5 millimeters of projection at the chin. And molars, let's see, that right first molar coming down about 5, that left first molar coming down about 2.5 now.
Mm-hmm.
Is that looking better?
Yeah. Clinically, he needs even more chin. That's the thing. And I know his chin is kind of behind, so we may have to move it forward with the genioplasty. But do you think we can do a little bit more occlusal plane correction to make it just
Sure.
a smidge more flat? I think for him,
Yeah.
it would be,
Get about a millimeter more. So there's 2 more degrees of flattening, down to 3.
Mm-hmm.
We'll go down coming forward 13.5 now.
Yeah, because in his case, we're coming from 8 to 3, which is only 5 degrees, not a lot. Sometimes we do more. But I think that's what he really needs, is that.
Okay.
He really needs that. So I can see interference here at the upper and lower jaw, right there at the osteotomy. So I'll have to get that, especially on that.
Yeah.
Especially on that
You're
side.
talking about that second molar?
Yeah.
Mm-hmm. Yeah, you'll reduce that standing ramus a little bit.
Yeah, we'll have to grind that ramus down.
I might be able to. All right, so we're advancing the upper incisors 10. Slight midline correction, 0.5 millimeter of the patient's left.
Yes.
And we're coming down to. We corrected that cant, bringing that left side up and that right side down. So the molars right now you're going down about 6, and that left first molar coming down about 3.5.
Mm-hmm. Yes.
And lower incisors advancing about 17.5, and Pagonian coming forward about 13.5.
Yeah, and I'll probably do chin. Can we do the chin osteotomy on the planning as well?
Yeah, absolutely.
Thank you.
Are you just doing a sliding genioplasty forward?
Yeah, just down and forward.
Okay. Did you want any guides for the genioplasty, or just a simulation?
Simulation.
Got it. How much more advancement did you want to see?
Probably 4 millimeters advancement.
Okay. Forward 4. And did you want to lengthen the interior?
Yeah, lengthen the whole thing probably.
Okay.
Yeah, like 4.
There's forward 4 and down forward as well.
Yes, I think that's good. Mm-hmm.
Going on about 17.5.
Yeah, I think that's That's the best we can do,
Okay.
at this point. Yeah. I think that's good because that's my comfort level. I don't want to go bigger on the incisor because I don't want to do more than 10. 10 is kind of my,
Yeah.
I know I can do 10. Everything else is just much harder, during the operation. So.
Yeah, definitely. And yeah, depending on the patient, you might run into some more restrictions.
Mm-hmm.
Yeah, I think that, I know this is accurate, but yeah, that's a pretty big improvement.
Yes. Excellent.
All right. Anything else you want to see as far as movements go, or any measurements I can show you that would be useful intraoperatively?
No, but based on that soft tissue profile, what's his tooth to lip ratio from what you see on that initial thing? I think that's more or less acceptable, right? 2 millimeters. Because clinically he was like 2-3 millimeters
Okay.
in needs, so I don't know.
Yeah, looking preoperatively, that looks more like pretty well.
Yeah.
Lips, I think, are probably the least accurate projection, especially with big movements like this.
Yeah.
So it's tough to, and there's always some variability with the incision of a heel that would affect the, as we'll show. So.
Cool. Well, I think that's that's what he needs: big lengthening, airway advancement, and everything. So we're getting that for him.
Perfect. Yeah, sounds good.
Awesome. Thank you so much. I think that's pretty good. I just want to see the splint thing.
Sure. Yeah. You got it. Are you doing mandible first?
Yeah, mandible first. Yeah.
Okay. Here is that intermediate position. It looks like you'll likely have to do that reduction on that right anterior ramus.
I see that. I see that, and I saw that on the model surgery. When I was splitting that upper jaw, I saw that.
You did. Okay.
Yeah.
Sounds good. Well, we'll probably draw that out. I think your support just to confirm.
Yes.
And do you want any holes in your intermediate splint, or do you like that design that we did for that last case?
Yeah. Same thing like we normally do. Yeah. Mm-hmm.
Okay. We'll do that, the tongue cradle in there.
Yes.
And same thing with the final, just a little bit of thickened palatal flange.
Yeah. Yeah, just so it's called expansion. I usually just wire them into the splint for a month.
Sure.
If I have to.
You got it. And surgery I have as the 9th of February. Is that right?
Yes.
Okay. And then are we going to be shipping everything to your office, Galleria,
yes.
OMS?
Yes.
Okay. All right. Well, that sounds good. We'll keep rolling on these splints, and you should be seeing everything sometime next week. We'll shoot for earlier next week.
Okay. Thank you so much. Thank you.
Yeah. Anytime.
Yeah. Excellent.
Enjoy your weekend.
Yeah. Thank you so much. Thank you. Bye-bye.